Studies have found diminished folic acid levels to be associated with cancers of the cervix, colon and rectum, lung, esophagus, brain, pancreas, and breast. The Nurses' Health study of 88,000 women over a 15-year period reported markedly lower risk of colon cancer with folic acid supplements. Alcohol interferes with the absorption and metabolism of folic acid. However, increased alcohol intake in individuals who consumed 650 micrograms or more of folic acid per day was not associated with the increased risk of colon cancer. Another B vitamin, vitamin B12, has also been shown to aid in the prevention of breast cancer. The risk of breast cancer was more than doubled in women with low serum vitamin B12 levels compared with those with the highest blood levels. The Food and Nutrition Board recommends B12 supplements for all people over 50 years of age. Many people over the age of 50 are unable to absorb enough vitamin B12 from the food they eat and must obtain it from oral supplements. Several studies indicate that death from cancer, including lung, colorectal, and prostate cancers, is lower among people with higher blood levels or intake from the mineral selenium. An intervention trial undertaken among a general population of 130,471 individuals in 5 townships of Pudong, China, a high-risk area for viral hepatitis B infection and liver cancer, provided table salt enriched with selenium to the population of one township, 20,847 people, using the other 4 townships as controls. During an 8-year follow-up period, the average incidence of liver cancer was reduced by 35% in the selenium-enriched population, while no reduction was found in the control populations. Studies have demonstrated that the incidence of prostate cancer, colorectal cancer, and lung cancer are notably lower in groups given selenium supplements. Vitamin D is synthesized into the human skin by exposure to sunlight. A study of women who participated in the first National Health and Nutrition Examination Survey found that vitamin D intake was associated with a reduced risk of breast cancer, and the Nurses' Health study of 88,000 women over a 16-year period confirmed this result. A study has found that low vitamin D levels were associated with earlier and more aggressive prostate cancer development. Aging is considered a risk factor for vitamin D deficiency. As we grow older, we have a reduced capacity to synthesize vitamin D in the skin when exposed to sunlight, and the kidney is less able to convert vitamin D to its active hormone form. We are also more likely to stay indoors and use sunscreen. The application of sunscreen with an SPF factor of 8 reduces production of vitamin D by 95%. A 5-year study of more than 120,000 people found that men with the highest vitamin D intake had a risk of colorectal cancer that was 29% lower than men with the lowest vitamin D intakes. Low levels of magnesium and boron, common in senior citizens, are known to result in resistance to some of the effects of vitamin D. A large study found that increased consumption of niacin is associated with decreased incidence of oral, pharyngeal, and esophageal cancers. An increase of niacin intake was associated with about a 40% decrease in cases of cancer of the mouth and throat, with a similar decrease in cases of cancer of the esophagus. Several studies have shown a reduction in prostate cancer risk with adequate intake of lycopene. Colorectal cancer is the most common gastrointestinal cancer and the second leading cause of cancer deaths in the U.S. Calcium supplements have demonstrated 14% lower risk of colorectal cancer. Vitamin C supplements have been shown to decrease the incidence of cancers of the mouth, throat and vocal cords, esophagus, stomach, colon, rectum, and lung. The American Cancer Society study of 1 million adults found vitamin E supplements reduced risk of death from bladder cancer. The formula of REQ49+ is based on the results of controlled trials involving millions of people that have been published in thousands of peer-reviewed scientific journals. REQ49+ provides critical micronutrients that studies have shown can aid in the prevention of immune dysfunction, muscle weakness, fibromyalgia-like symptoms, depression and abnormal fatigue, heart disease, dementia, Alzheimer's type, metabolic syndrome, cancer, arthritis, osteoporosis, vision disabilities.